As health authorities globally are closely watching the outbreak of respiratory illness that has caused panic and fear, the WHO continues to say that we do not have to panic. Don't panic, don't react, take action, be vigilant. Very quickly, if we remind our viewers and the general public once again, Dr. Penze, what preventive measures they can take to address this situation.
So, hand washing before food, after you've been to the toilet, after you've had sneezing or coughing, if you have been outside, you're coming back, frequent hand washing is important. Respiratory hygiene, cough in a tissue or cover your face or in a crook of your elbow. After you've sneezed or have it, wash your hands. If you are sick, having fever or cough, avoid going to your place of work, or if your children are sick, don't send them to school. If somebody is sick, avoid contact if you feel that there is. So basically avoid contact with places where there may be sick people, for example, hospitals. Avoid crowded places because you may not know who is having those that infection. And just being vigilant of our surroundings. And because this is an animal origin, handle your animals or meat appropriately, and cook your meat properly so that there is no transmission through the food that we eat. So safe food practices, respiratory hygiene, hand hygiene, these are some of the things which will help you prevent.
Prior to yesterday's decision by the WHO to declare a global emergency over the novel coronavirus outbreak, there have been calls to do so from the outset, with the argument being that it would make coordinated efforts efficient. That said, its country representative Dr. Razia Pense revealed even the identification of the one and only confirmed case to be reported from Sri Lanka was done with WHO collaboration with local authorities.
There's a lot of collaboration going on with other countries, with other institutions, so that we can know more about this virus. This is a new virus. We don't know a lot about it, and unless we know more about this virus, we will not be able to give the right kind of advice on what needs to be done. That's why it requires a lot of collaboration and cooperation, from getting information on the clinical data to the various virus genome sequencing, which actually has been shared very quickly by countries. That has enabled countries who have had these cases rapidly diagnose them by developing the tests that are needed. For instance, in Sri Lanka, the one case that was identified as positive, that was through a local reverse transcriptase PCR reaction test, as we call it, that was developed by the Medical Research Institute here with support from a WHO collaborating center. So there is a lot of collaboration and cooperation ongoing.
शूरयन के नोबिदिन विश्वासी समके मैक्सिस